This video is about social phobia or social anxiety disorder. This is one of the most common and disabling psychiatric illness. This video is to highlight the symptoms of social phobia. The essential feature of social phobia is a marked and persistent fear of social or performance situations in which embarrassment may occur. Exposure to the social or performance situation almost invariably provokes an immediate anxiety response. Most often, the social or performance situation is avoided, although it is sometimes endured with dread. Although adolescents and adults with this disorder recognize that their fear is excessive or unreasonable, this may not be the case with children. In feared social or performance situations, individuals with social phobia experience concerns about embarrassment and are afraid that others will judge them to be anxious, weak, crazy, or stupid. Patients with social phobia may fear public speaking because of concern that others will notice their trembling hands or voice, or they may experience extreme anxiety when conversing with others because of fear that they will appear inarticulate. Patients with social phobia may avoid eating, drinking, or writing in public because of a fear of being embarrassed by having others see their hands shake. Individuals with social phobia almost always experience symptoms of anxiety. For example, blushing, palpitations, tremors, sweating, gastrointestinal discomfort, diarrhea, muscle tension, blushing, and confusion, and, in severe cases, a panic attack. The person with social phobia typically will avoid the feared situations. Less commonly, the person forces himself or herself to endure social or performance situation, but experiences it with intense anxiety. Marked anticipatory anxiety may also occur far in advance of upcoming social or public situations. Example, worrying every day for several weeks before attending a social event. The fear or avoidance interfere significantly with the person's normal routine, occupational or academic functioning, or social activities or relationships, or the person must experience marked distress about having the phobia. For example, a person who is afraid of speaking in public would not receive a diagnosis of social phobia if this activity is not routinely encountered in job or classroom and the person is not particularly distressed about it. Common associated features of social phobia include hypersensitivity to criticism, negative evaluation, or rejection, difficulty being assertive, and low self-esteem or feelings of inferiority. Individuals with social phobia also often fear indirect evaluation by others, such as taking a test. They may manifest poor social skills, for example, poor eye contact, or observable signs of anxiety, for example, cold clammy hands, tremors, shaky voice. Individuals with social phobia often underachieve in school due to test anxiety or avoidance of classroom participation. Persons with social phobia often have decreased social support networks and are less likely to marry. In more severe cases, individuals may drop out of school, be unemployed and not seek work due to difficulty interviewing for jobs.